MDs. What has been your experience? It sounds like you are people who would be able to say to your patients, you know, I don't know. And that, to be able to give that kind of answer to your patients. And do you find resistance to that sort of answer? Do you find resistance to leaving some ambiguity in your diagnosis, in the way that you're dealing with your patients, or do you feel that that gives them, empowers them in some way? Does that make sense?
Are you suggesting we don't know?
Not you.
I think, did you want to?
I mean, I feel, every day I am always curious by presentations. Even, you know, what we end up doing is finding patterns that we recognize as sort of avenues to enter into helping a person get on track. And every day there's a new scenario that makes us or challenges us. There are certainly times when we don't know, and in my personal practice, I've said, I have to look this up, I have to do more research, or please, let me get back to you next week. Or maybe I have a colleague that I think would be better suited to come to a conclusion.
And do you find that people find that their expectations haven't been met, or do they accept that from you?
I think as long as well, I would answer it two ways. Number one, of course, patients are very happy to believe that I know somebody that can help them find the solution, or that I can help find it if I put in some extra time. And then as long as I give them a prescription for Viagra, they'll probably just do this way.
I don't know most of the time. I don't know most of the time, and I say to the, I mean, it depends on the context. If they ask you something like, what's this medication, you know, I could say what Jeff said, I'll find out, I'll figure it out. But the thing that I don't know is what's going to happen next. What are we going to do together? How are we going to figure this out? What's going on? Like Nomi, the example that Nomi gave of back pain, which is one of the most common things, we don't know. We don't know what is causing it. But we can do things together that may help. We can address it. We can try physical therapy and exercise, and you know, we want you to keep doing that. And I won't leave you. We're going to work on this together.
And Jesse, have you also had patients who may have brought you information that's where, like, sometimes patients do their own research and say, this is what I've been experiencing. Can you help me work through this? Like, and then I read it.
Right, and you're not familiar with what they're bringing you, and is that you say, I don't know. Yeah, I'm not familiar with this. I think patients are. I don't think patients have a hard time with that. I think the thing that patients want is to be able to trust their doctor, to be able. That means everything, and it's not really a knowing, but it's a trust that you will advise them as best you can, that you won't, you know, give up on them or put them in a dangerous situation, that you'll work with them, that you'll stay with them. You know, they can do things and bring it to you and you can talk about it. I think that's what, I don't think they're that much into knowing. I mean, they want you to be competent, of course,
So I wanted to hear from Mary and Gwen in terms of this knowing business, because I think that as quite a non-medical people, I think you have a different experience perhaps of wanting to know, or is it the same, or, you know, because I think it's very pervasive myself.
Yeah.
Mm-hmm.
I'll let you tell.
Yeah.
I was thinking about what you were asking. And there's different kinds of not knowings, I find, both as a patient and also both as a patient and also as a therapist, as a teacher, you know, in your different roles with people. And when you were first speaking, Jesse, about your interaction with your patient, Oh, no, when you were at the Grand Rounds or
The medical school.
when you were suggesting that people could say to the person who's not doing the things to lose weight that they're supposed to do or whatever, that the doctor could say, what should we do now? I think that that's, and that you were just talking about now, saying to people, I think that's a kind of knowing, not knowing, that's very intimate, and I find that extremely uncomfortable with medical professionals. And I know the work that you've done, Susan, that I've done with you some around teaching doctors how to improvise with what patients do say to them. Was, I thought, so useful because a lot of times I think people go to, I have to have something, I have to know what to say here because it's uncomfortable. It's intimate, it's, you know, it's, and times I've tried to have those kind of conversations with a medical doctor, I feel very embarrassed, you know, to kind of go into that direction that we don't know what we're going to do together. We don't know what to do together. So I think that there's the not knowing.
How much time do you think is required during that doctor-patient interaction in order to get to the point to explore that that not knowing part?
Well, I think maybe you could answer because.
Well, I think it's part of building what I was saying about building a relationship. It may not happen in one visit. Like, you know, the first visit, you go over the history and you do a complete history and physical. It's a new patient. You're trying to, you know, collect the information. And there is real information and you know, things that are important. There's what we call data that you want to know about the patient's risk factors and all of those things. But I don't think that necessarily is on the. Sometimes it is, and I think that the issues with time is really such a disservice, such a tragedy. Is one of the failures of medicine that doctors can't spend enough time with patients. It's like 10-minute, 15-minute visits. You know, it's never enough. But I kind of address that somewhat in terms of having a long-term relationship, seeing the patients again and again over time and getting to know them and they're getting to know you. I also am in the community, so I see my patients, I go knock on doors and do voter registration and talk about the campaigns, political campaigns. And I see my patients out there and they know that I'm out there. So that's helpful.
Yeah.
But I appreciate what you're saying about the discomfort, and I think there's discomfort on both sides, and some patients will feel very uncomfortable with the doctor saying they don't know. I don't mean it in that way of it's kind of conveying an incompetence. I mean an intimacy, just like you were saying.
I think I have an advantage in the sense that I actually tell the people who come to me, I don't really know. Because what I'm interested in exploring with people who come to me is to actually discover not knowing. Because we know what hurts. We don't always know what really feels good. And so what we're trying to discover is all the resources that actually build support so that what hurts doesn't take center stage for our attention all the time, and that maybe there's more options for then dealing with what isn't comfortable, because we have more of what is comfortable. So I'm, in a sense, in the job of not knowing, and it always amazes me when I am exploring something with somebody, and they say, oh, you know, my left shoulder is and we do something in their right knee and their shoulder feels better.
That's somatic experience, isn't it?
It's an.
Am I beginning to understand?
I'm not doing the somatic experience with a capital S and a capital E, because there is a practice called somatic experiencing, but I do somatic work, yeah. So, just, I can't remember how I got sidetracked, but
sorry.
no, that's okay. So it's always amazing when something like that does happen, and I only know certain things to a degree because I've had the time to hang out for so long with my body, with many bodies, and I get a sense of how things are connecting in different ways.
And that's like a perfect reason why dualism just can't possibly exist. Like that's how you almost are getting a perfect example of holism. Like how can your left shoulder pain go away if you're focusing on your right foot?